Yeah, so just a little bit about myself. I am the Pediatric Quality Improvement Specialist here at First 5 California. I've been working on enhancing and strengthening developmental screening, early identification, and referrals to support services in San Francisco and now in Alameda for about 15 years. Sujata, do you want to?
Sure, thanks, Zulema. Hi, everybody. My name is Sujata Bansal. I am currently with WestEd as an infant and early childhood mental health specialist. But previous to that role, I was with First 5 Alameda County for 18 years and did a lot of work on infant early childhood mental health consultation for the county, now for the state, and did a lot of ASQ and ASQ-SC training as well when I was with First 5 Alameda County. So it's a pleasure to be back with some of my old coworkers and meeting some new ones to be here with you today. So, and then just in case you missed some of the housekeeping, just we're asking as much as possible, please keep your cameras on. Of course, if you need to take a break and all of that, you're welcome to do so. We will have some breakout rooms. So during that time, we will ask that you have your cameras and mics on. And feel free to, ask questions mid-presentation, either come off a mute or drop something in chat, and there will be folks monitoring chat as well. There's also a link to the materials in chat. If you want to go ahead and pull that up, we will be referring to some of those materials throughout.
Thank you. All right, so let's get started. And let's talk a little bit about what we're going to run through today, just so that you have a good sense of what we're going to be covering. Today, we're going to be talking about the ASQ-3 Ages and Stages Questionnaire, 3rd edition. We're going to go over the benefits of screening, why it's important, why we ask people to provide these questionnaires to families. We're going to go into detail about the features of the ASQ-3, especially those that are going to help us introduce them better to families and work with families together. We're going to talk about those cutoff scores, what they mean, how to interpret them, how do we get a sense of where the children are developmentally with these questionnaires. We're absolutely going to talk a lot about collaborating with families and parents, especially because this is a parent-completed questionnaire. So how do we share those results with families? How do we talk about their child's development, what we're learning from these questionnaires? And then if there are concerns, how do we talk about, even if there aren't any concerns, how do we talk about what's next, right? Now we have this information, how do we put it together in a way that we can share those results with families and talk about how to keep supporting and promoting their child's development? So let's talk a little bit about these questionnaires specifically. I know some of you had said that this is the first time you're learning about these, so let me tell you a little bit about what they are. These are, like I mentioned, parent-completed or caregiver-completed screening tools. Because they're parent-completed, it really encourages that engagement of families, so making sure that we're really learning how to bring families along in those discussions around their child's development. These are a series of questionnaires that are appropriate for children as young as 1 month, all the way to 66 months or 5.5 years of age. These have been highly vetted, used for a very long time in the community, and we know that the research behind them tells us that we can really trust that they're going to identify children who are at risk for developmental delays, so that we can get them connected to supports as early as possible. And because they are developed for families, they really also are tools that can help us teach families a little bit more about child development, how to make good observations on their child's skills and milestones, and really help us guide families into promoting their child's development, right? We want to make sure that we're not only just identifying concerns, but really helping families help their kiddos move on to that next stage of development. The ASQs were developed in Oregon at the University of Oregon a long time ago in 1980. Because they're at a university, they have a lot of support there for research and review for child development, tests, textbooks, literature. They used all of that in order to create these questionnaires. They did a lot of work on selecting specific skills, right? So there's a lot that goes into child development. And these questionnaires, have a very limited capacity for asking all those questions. So they really looked at what were some of the best skills to select for these questionnaires. And so they looked at the skills that are going to be most easily observed, right? There's not going to be a lot of second guessing yourself, right? So for example, in the gross motor section, there's a question around, can your child stand on one leg for 10 seconds? That's something that we can easily observe. A lot of other people can easily observe that. There's not a lot of second guessing. And they also had skills that would most likely occur in a home setting, right? Not using a lot of special toys or special materials, things that we're going to see every day at home. And just to give you a little bit of history, the ASQ-3, the edition that we're talking about today, was published in May 2009. We hear rumblings about ASQ-4 coming, but so far we're still working on this edition. So we're going to talk a little bit about some of these terms that you might hear used sort of interchangeably. Sometimes we say assessment. What does that mean, right? There are 3 different types of assessments that we mostly see when we're looking at early childhood, in that early childhood field. And each of these terms has a specific purpose. And so we're going to talk a little bit more about what they are and how they're different from each other. So starting with the first one, a screening. A screening is a brief procedure, so it should be short, it should be snappy, and it's used to help identify children who might benefit from more intensive assessment or for more evaluation, right? So this is something that is good for everyone. If you think about it, it's like when you go to your doctor's office, right? The nurse will check your blood pressure, will check your eyes, your ears, your weight, right? They're just monitoring, they're just checking in to see if things are the way that they would expect them to see, right? So there might be, for example, your blood pressure is too high. It doesn't really tell us why. You could have had an extra cup of coffee. You might have been running late and had to, run to catch the bus. It just says something is going on and let's check in a little bit more, right? And so that's the next level. So that's the diagnostic assessment. This is a more in-depth look at that area of concern. And it really helps us determine what is going on with the concern, where it's coming from, how extensive that concern is. And sometimes it's also used to make children eligible for early intervention services. So if you think about the system, right, we screen all children, only a few would we say, something else is going on. We've identified some risks, and so we might need another assessment, a diagnostic, a more in-depth, just looking at that area where we've identified that concern. And then the last sort of level is that monitoring. So we know that children might have concerns that don't reach the level of eligibility for certain entitlement agencies like the regional center or like school district, early intervention or early childhood special education services. But we still want to make sure that we're checking in and seeing if that would support that we can continue to help children meet their milestones. So we want to what we call monitor them, right? So this is just the surveillance. This is checking in that area of concern. We might redo or we might offer another screening, right, to see if with support we can help support that concern, or if the concern seems to be getting bigger, then maybe we can use that information again to refer them back to, a diagnostic assessment. So this is something that we want to continue to do, right? Just check in, maybe offer another screening or offer some support, and then see where that child's development, how that child's development is progressing. Especially for those younger children, we want to do this a little bit closer. So if we're screening once every year, we might want to monitor or do some surveillance, every 4 months or every 3 months, just so that we're checking in periodically and seeing how that concern is progressing or if it's getting bigger. And even though screening is really important and really helpful, it's not the end all be all, right? So we want to just remind you that when you offer families a tool like the ASQ-3, we are not diagnosing delays. We're not saying they are delayed. We're saying they're at risk for delays, right? We don't know if they have a disability or are at risk for disability. So screening is just something that helps us identify concerns so that we can then think about what next. So we want to make sure that we're being careful when we're sharing results, right? So this screening is not a diagnostic assessment. It is just something that helps us identify where a child might need some extra support or opportunities to practice. And we don't want to use the questionnaire, the ASQ, as a way to put some plans or skills or goals for children, right? It only tells us where to start. So we want to say, okay, well, it looks like they're having some delays in their fine motor. Let's look at that whole area of fine motor and think about what skills we can then practice. But we don't want to use the questions on the ASQ to say, okay, let's just practice these 6 questions, right? We want to make sure that we're really giving that whole area a lot of support and a lot of thought. So we want to make sure that we're using the tool the way that it was intended and developed for us to use.
Thanks, Zulema. Okay, so before we, so now that you have a basic understanding of screening and how that is different, but before you put those up, Zulema, I want to ask the group, and feel free to come off mute and share or type in the chat. What do you think, and I know most of you are currently working with young children and families, what do you think are some of the benefits of developmental screening? Why would you choose to do it?
You can go, Sujata. I feel like what I've seen is like just meeting with providers isn't enough. There's sometimes questions that we don't ask that could be on the screener that will help us, right? So I'll start there.
Right. Okay. So it's a way to get more information that you might not get just in your regular conversations with the families.
And I would also add, just to piggyback,
Yeah.
if a child is showing some delay in some areas, it's better to start those early intervention services sooner than later, so that the delay doesn't get even more challenging to address.
Exactly. Like we are all in this field because we believe in early intervention, right? That's why we're choosing to work with young children. And so the earlier we can identify if there might be a concern, that means the earlier we can provide support services and hopefully mitigate so that whatever that concern might be doesn't actually grow into an actual concern or disability. I'm seeing some things in the chat about access to services earlier. Again, we're all about early intervention. We want to identify as quickly as possible, provide support as quickly as possible. It allows parents to see a snapshot of where their child is exactly. This is, as Zulema started with the, the entire training, this is all about parent engagement. It's about getting parents on board as well and giving them tools so that they can better understand their child's development, use that for advocacy purposes. Parent provides awareness for parents, exactly, know that their children are at risk. Yep, exactly. Okay, so you guys have hit on I think everything that I've had on here. So Zulema, if you can start doing your fancy animation. So also some programs do mandate developmental screening, such as early Head Start programs, programs that often have federal, state, or braided funding. They often do mandate it exactly for the reasons that you all mentioned. And so that's important to know. As you said, it identifies children early. So what we want to do is if there's a chance to catch something early, we want to know that so that we can provide the services early. Also can detect, where a child is doing well, right? So that's helpful. Just the same that we want to know where a child might need some support. It can also tell us, hey, this child is doing really well. They're right on track for this. So, sometimes maybe a parent has a concern, and this can help them feel better, and by saying, you know what, your child's doing great. They're right where they should be. And then, the parent engagement part, you're going to hear us both talk about that a lot, because that is such a big part of this work. And so this is really a nice way to engage with families, to do some a little bit of parent education in a very sort of soft and gentle way. It helps parents feel and caregivers feel heard. One of the main things that I hear when I work with families, caregivers of young children, is that, oh, nobody's listening to me. I've identified something, or I have a concern, but nobody's taking me seriously, right? I know I had that experience as a parent as well. And so this is a nice way to really address family concerns, help the parent feel heard. And also what I really like is it gives the family a concrete tool and a way to talk about their child's development that can't be dismissed by whoever it is that they're trying to get to pay attention to them. Because, as Zulema shared, this tool has been around for a long time, 40 years now. It's widely accepted. And so if a parent goes in and says, hey, I've had the ASQ, this is what it shows, pediatrician, childcare provider, whoever can't just dismiss that. So it gives a family a tool. So that's really nice too. All right, so let's talk a little bit about what might be some of the risks for developmental delay in starting with the really young children. What have you guys seen as possible risks for developmental delay? Okay, yeah. So some people are putting things like prematurity, health hazards, like if they've been exposed to things like lead poisoning, could cause delays in different areas. A couple of folks put communication, speech, medical syndromes, exactly.
What about during pregnancy, like complications during pregnancy and other exposures?
Exactly. Exposure during pregnancy, lack of prenatal care, for example, low birth weight, abuse. Yeah, you guys got this. All right. So yes, to everything that's showing up. So as Peggy just shared, during pregnancy, if there was any exposure, if there was lack of good prenatal care, which can sometimes catch things, maybe during prenatal care, they can identify that, hey, you need more of this type of vitamin, or we need you to be on bed rest, or you need, so lack of that can lead to possible negative outcomes. Prematurity, which we will talk about, and I think I saw a question in the chat about calculating for prematurity. We will go into detail on that, so not to worry. But yes, prematurity can be a risk. And then there's a whole host of environmental and social risks as well. So, we know that taking care of a young child is extremely difficult, even in the best of circumstances. Even if you have all the resources in the world, it is a difficult task. So now think about caregivers who lack support, who don't have access to resources, who are struggling for a variety of different reasons, whether it's, they're income insecure, housing insecure, food insecure, whether they're dealing with substance abuse, domestic violence, any exposures to violence, any exposures to stressful situations. All of that can lead to, a possible risk for developmental delay, because they're just not able to provide that focus and the attention that young children demand of us. And those early years are so important. 80% of brain growth happens in the first 3 years of life, 90% by age 5. So those early experiences and what young children are experiencing, seeing, hearing, feeling on a daily basis directly impact the way that their brain grows, the way that their body grows and develops. So we want to make sure that they are in the best environment possible so that they can reach optimal development. And one of the things that I always like to remind you all of, I know I'm preaching to the choir, but you all are supports to these families, right? So a child can have multiple risk factors. They can also have multiple protective factors. Protective factors can be other caregivers, can be where they receive childcare. It can be folks like you who are coming in and supporting the family and getting them, resources, providing help. That can have a huge counter effect on these risk factors. So just because a child or a family has these risk factors doesn't mean all is lost. We can mitigate that with the protective factors, and you all are part of that protective factor network. Okay, so here's an interesting chart. Go ahead and pop up the numbers. And I'm want to know from you all, what do you see? What do you see happening here? This is the incidence of children identified as having a disability. So this is actually, they've been identified as having a disability by age. So infant is 0 to 1. Preschool age is, around 3 to 5, and then it's school age. What is it that you're seeing, and why do you think you're seeing this trend?
From the data, I've noticed that most children are identified while they are in school age.
Mm-hmm.
And I feel like the reason is because while they are in school age, there are teachers, other paraprofessionals that can identify these concerns, while as an infant in preschool, most parents aren't reaching out or have access to resources or doing the developmental screenings, so they miss the window of early intervention.
Exactly, right. So you've got more eyes on this kid at school age, right? There's more adults around who are trained to kind of be looking for these things, whereas infant and preschool, you may or may not have, not all kids are going to preschool or childcare. So there's maybe less eyes. There's maybe less, there's a lot more, oh, they're still young, they'll grow out of it. I know that our pediatrician said that to me all the time, right? They'll grow out of it, they'll grow out of it. Whereas the older the child gets, then the less you start hearing that. Exactly. I see a couple more things in the chat. Consistent eyes, lack of early intervention. It's much harder to access services. Parent denial. Yep. And many pediatric clinics. Yeah, pediatric clinics are incorporating these screeners. Actually, First 5 has a lot to do with helping pediatric clinics do that. We're going to talk about that. So yeah, exactly. So what you see here is that children are being identified, but it doesn't necessarily mean that those disabilities couldn't have been identified younger, right? And that is the whole goal of this, is can we identify, or can we at least, because this doesn't identify a disability, but can we at least notice earlier that there might be a concern? So you have more eyes as the children's growing up. Children, it is possible that they are acquiring, delays because maybe the environments that they're in aren't the healthiest or the best. And so that's leading to the developmental delays. But, not enough to account for this 10% difference that you're seeing here. And so the whole idea is the earlier we can identify, if we can identify more of those kids who were identified later, that means we can provide intervention earlier as well. Okay, so I'm going to talk next just a tiny bit about our the technical data and report. For those of you who are really interested in data, the ASQ Users Guide has a whole section on how they went about designing the tool and all of the data that went into it, and how it meets the standards for a tool that's considered to be good at what it does. But I'm just going to share a quick piece of it here. So as Zulema shared earlier, we have the ASQ-3, which was came out in 2009. And they did, in order to have a tool be widely in use, it has to be standardized, also has to go through a reliability and a validity process. So the originators of the tool did test out the questionnaire. Over 18,000 questionnaires were completed by children in the age range. The tool does meet standards for validity and reliability. So what does that mean? So a tool is valid when it accurately measures what it says it's going to measure. And a tool is reliable when it consistently measures things in the same way. Peggy, I think you have your hand up.
I do. I have a quick question. Like when we, I don't know if you know this or not, but when we say it was completed by parents of children, do we know like the background of these families? Or is it all white people, or is it like out of ethnical range, disability range? Okay.
Great question. And we'll get to that too. We'll get to that. That's actually coming up for next. But I just want to go back to really quickly to validity and reliability, because these are really, really important terms. It's important to know that the ASQ does meet standards for validity and reliability. And so what that means is so there's inter-rater and intra-rater reliability. So if the same person does the tool on the child in a different setting, it should yield similar results. If different people use the tool with the same child, it should yield similar results. So we don't want to see huge variations there. There may be some variation as long as it's not statistically significant, it's okay. Validity, we want to make sure that it's actually measuring what we say it's going to measure. So if we say we're looking at fine motor skills, we want to make sure that the questions on the tool are actually looking at fine motor skills and not missing that for something else. So I'll give an example. I came from an immigrant family, and a lot of stuff, well into my teen years were very new to me in this culture. I was sitting for, I want to say it was maybe one of those standardized tests, a PSAT or a SAT, something. And they were asking those analogies, like this, X is to Y as, Z is to what. Yet the terms that they were using were terms of things that were like on a boat or a yacht or something, like terms that I was just not familiar. I didn't know what those parts were. So it wasn't really testing my ability to identify analogies because the terms that they were using were not familiar to me. So things like that are things that when you are testing the tool, you're looking for things like that and making sure that you are actually going to capture the skills that you're looking for. Okay, so let's go back to Peggy's correct question around, who used this tool, these 18,000 folks. So they did look at, for these families, they tried to get even representation in terms of gender, ethnicity, mother's education. And the reason for that is because that tends to be pretty predictive in terms of child outcomes. Family income, they looked at a variety. So they wanted to make sure that they had a diverse sample. And then they also looked for, different medical or environmental risks to the child. So things that we had talked about that can influence these outcomes. So they really aimed to get a wide sample size. And then in terms of the ethnicity data, just so you can see here, who was in the sample, what percentage that represented, and then how closely it matched the 2007 census, which was the data that they had at that time. While it's not a completely even, match here, as you will see, there are some differences. This, by tool development standards, is considered, a good sample size. So again, if you would like to really delve into the technical report, the full report is in the ASQ Users Guide. All right, finally, cultural adaptability of the tool. So one of the things I love about this tool is I like to call it a soft tool. It's flexible. It allows you to adapt it so that you can best meet the needs of the children and families you're serving. So some of the things that you are allowed to do are you can use alternative administration methods. We will go through how to administer the tool and give some general guidelines and suggestions. But, you know, you might walk into a setting and be like, you know what, that's not going to work. I'm going to have to do it this way. I'm going to have to go out of order. I'm going to have to use different materials because the materials, you know, are not available or not familiar to this child. And it allows you to make those decisions using your best, you know, professional judgment, of course. Go ahead, Zulema, with so alternative materials. The normative sample, as we talked about, did include a diverse population. And you can also omit an item if none of these other methods are working. You can't change it. You can't use a different material. You can actually omit an item. We'll talk more about that and how many items you can omit and how you score. But you can omit items that you just feel like are not appropriate and still come up with a valid score. So it's one of the reasons I really enjoy using this tool. All right, I'm gonna kick it back to Zulema and I will try.
Okay, thank you, Sujata. So let's talk a little bit about the features of the ASQ. And like I mentioned, especially those that are going to help us use this with families a little bit better. So we want to talk a lot about the number one feature, right? So this is probably my favorite feature, is that it is a parent or a caregiver completed questionnaire. So what that means is we really want to encourage families to be partners in this questionnaire with us, right? So we are supporting them to fill this out. So there was a question in the chat around, you know, do Head Start teachers fill out the questionnaire or do families? You know, it really depends, but all of the research that was done on this questionnaire was done with families filling this out. And so we really want to continue that process as much as possible and looking at our methods of administration to make it as supportive for families to really fill this out. And the reason for that is because, you know, we might have some knowledge of that child, but really families know the most about their children. They are the best source of information. They really, you know, have an idea of what's going on at home, especially, which is really going to be helpful to us, you know, especially if we maybe only see the child, you know, in the medical setting once every couple of months for 10 minutes, right? Or even if we're at a child care or preschool, you know, we might see them a little bit more often, but in the long run, the family is going to really be there as much more than anybody else. We also know that if we are asking providers to do this, we're taking up some valuable time that can be used doing something else that is more within their role, right? So we really want to make sure that we take advantage of families because we don't want to take up the time of a professional or provider who can be more expensive, be more time consuming, right? If we have that pediatrician only for 10 minutes and we're taking that time having him answer these questions or him or her answer these questions, that could be really stressful, expensive, and not at all as supportive, right? So we really want to make sure that we're using, that we're taking advantage of families' knowledge and families' time to answer some of these questions. And especially because, you know, even if we are in a childcare setting and our role is to teach, we still want to make sure that, you know, we're only going to have that kiddo maybe 1 year, 2 years, but this family is going to have that kiddo for the rest of their lives. And so we really want to make sure that we're, again, using the opportunity to help families and create these teachable moments for families so that they can continue to provide support, to look at their child's development with newer, fresher eyes, and to empower them to advocate for other supports that they might need, right? So really having families be a part of this is a way to help them really look at how to support their kiddo for the rest of their lives. And we know how important that homeschool connection is. And so this is really a great tool to start that process as early as possible. I talked a little bit about this as well. So with these questionnaires, it really also helps families sort of observe their children a little bit better with a fresher eye, with a new set of tools, and helps them communicate using the same language as other providers might have, right? So really teaching them, what does fine motor mean? What does gross motor mean? What is that? What is communication? All of those different domains that we're looking at with the questionnaire, we're giving that language to families so that they can go and advocate and have more richer conversations with all of the other supports in their in their community or in their circle. So one of the first questions I usually get is, can we trust families, right? So we are asking families to do this, but do we trust that they can answer these questions, right? And so like Sujata mentioned, this is a tool that has been highly vetted, and part of that is also looking at the research behind parent report. So really helping us identify and trust that when we ask families these questions, that the answers that we're going to get, we can rely, they're reliable, that we can trust that families are answering these questions. There's a lot of research that shows that parent report is reliable. They've had some research on families that that we're looking at cognitive delays. And in this research, really one of the highlights around this is that the types of concerns that parents raised around their children's development did not significantly change with, how the level of education of that family, how experienced they were, whether this was their first or third of many children, other demographic values. So we know that a lot of these research studies that they did are giving us this idea that regardless of where a family is social economically, we can trust what they're reporting. We also know that for language delay, some factors that contribute to that start within the family, right? So a lot of language delay might start because of things that are happening in the family. And so we really want to make sure that we're asking the family about some of those questions. We also know that with some of the symptoms that come along at a later age and school-related age, a lot of that could have been identified as early as children in preschool. And so really asking some of these questions as early as possible. We know that families are seeing some of these concerns at an earlier age. And so we really want to make sure that when we're using this, that we know that when we partner with families, that we're getting really good information and that we can trust and that we can use to help us support and to work together really as collaboratively as possible with families. So, I don't want to hammer on too much, but again, this is one of the best features of this questionnaire. And so using these questionnaires, these types of parent-completed questionnaires that really encourage that family engagement. Like I said, that homeschool connection is so important. And if we start as early as possible, it really is going to continue for the duration of that child's school life. And so having them be partners in this really encourages that involvement, not just at this young age, but throughout the school career of this kiddo. Also, it really helps to validate parents' concerns. There might be times when a family knows something is going on, but just can't verbalize it. And so this gives them that language. This gives them that that validation of like, I knew something was going on, right? I had this gut instinct, and this questionnaire is helping me verbalize it and helping me to share it with other people who can help me as a family member, as a parent, to support that concern. We also really want to make sure that families know how much we value their involvement and how important it is that what they know is something that we need and can use, right? So this tool helps us convey that value for and that importance for their own expertise, their own knowledge of their child and their child's development. And like we mentioned before, this tool really helps families learn more about some of those domains, learn more about what that means, what that looks like, what milestones are, what to look for, again, to create that advocacy level, that new fresh eye when they're looking at how their child is playing, and really to help them also learn how to play better with their kiddo, right? So if they're seeing some things, they can jump in and work on some of those milestones, some of those skills. And this is also a great tool, especially for those kiddos that we might already have some concerns around their development. It's a great tool that helps us bridge that communication. So it's not just us always going to the family and saying, hey, something's going on. This is really, you're seeing it and I'm seeing it, and let's work together on these next steps on how do we continue to support and promote. So it is a great tool to start that conversation, especially if there are concerns that are already being identified. This is a great tool to just have that conversation in a way that feels very collaborative. So we do know, however, that there are some things that we might want to just take with a little more caution when we're interpreting some of these results, or when we're talking about some of the things that we're seeing, right? So there are some families that might have some of their own issues in the background that might be happening that could impact how they answer some of these questions. It doesn't necessarily mean that we don't use these questionnaires, but that we might want to maybe support a little bit differently with families who have some of these characteristics. We might vary the way that we administer, right? We might provide a little more hands-on support instead of just, sending it home and waiting for it to come back. So families who also have some impaired mental functioning due to mental health, maybe substance abuse, other stuff like that. Mental health, I already said. We also know that these questionnaires are translated into a lot of languages. I think by last count 6. So I know that they are translated English, Spanish, they have simplified and traditional Chinese characters, Arabic, French, and Vietnamese, I think. But that doesn't cover the whole gamut, right? And so if a family has a different language that isn't included in those 6 languages, again, we might want to figure out a way to still have them participate, but we might want to look at a different method of administration. If a family is involved with child protective agencies, that might impact how they're answering these questions. If the child has been removed, right, they might not have a lot of time to do some of those observations. So again, we just want to be a little more supportive in the way that we administer these questionnaires with these types of families. Not that we don't, but we just try to involve them in a way that makes more sense because of this. I know Sujata is going to mention the reading level, but for some of our families who have a lower literacy level, again, that administration method is going to be huge, right? We don't want to send that home because it's going to be challenging for them to fill it out independently if they don't have the level of literacy required to fill these out independently. So for those families, can we offer, a plan B, right? So maybe we offer some office hours or some other ways to support the way that they participate and collaborate with us in filling out these questionnaires. Okay.
Thanks, Zulema. There was a question in the chat, and I think you kind of addressed it when talking about things to consider in terms of parent report. But one of our participants did ask about, what if a parent is worried about, having their child labeled, or, they don't feel safety or trust due to like racism or, any of the other isms. And I do think that certainly happens, and we need to be aware, and that's where our skills as parent folks who can support parents and create a feeling of safety and trust can play a huge role in that. And when that happens, we may just have to be patient and wait and, try and work with the child and the parent in whatever our capacity is until a family is feeling more ready and more safe. But, safety is a big concern, and they have every right to be doubtful of a system which systematically oppresses marginalized people. And so I think that in those cases, we just have to be patient and try and create a safe environment and provide whatever it is that we can by way of support for that child and family. Okay, so I'm going to talk a little bit more about some of the actual features of the tool. So there are 21 actual intervals, and you'll see them pop up here. And what you'll see is that the intervals start at 2 months and can be used, but they can actually be used for a child as young as 1 month and as old as 66 months, which is 5.5 years. So you'll see that they're spaced closer together in the early years, about 2 months apart. And then if you do the next piece of Zulema, then they go to about 3 months apart, and then finally 6 months apart. And part of the reason for that is just because development is happening so incredibly rapidly in the very, very early years that we want to catch those things and we want to really be on top of it early. And then, it slows down somewhat as the child gets older. There's not quite as many differences. So there's a little more spacing there. One thing to note, so there you'll see that the 9-month is bolded and asterisk. That one tends to be used. So that one was actually developed later and added in because of the healthy baby visits. So the pediatric settings do a 9-month well baby check. And so the developers of the tool thought, let's just make a 9-month questionnaire. It does overlap with the administration window for the 8 and 10 month. And so it's really up to the administrator to make a best judgment call on which tool they would like to use. But that one is primarily used in medical settings. I already talked a little bit about the spacing. Monitoring is always an option, and you can monitor as much as your time, budget, resources allow, as much as the family would like. So there is, no harm in doing the tool closer together. If you don't want to wait, you've done the tool at 30 months, you don't want to wait 3 months, you can always monitor earlier. When you get the tool, it does come with, I don't know if it has the same titles now, but they used to be called like learning activities or just different activities that can support a child's development in the different domains. And they are based by age range. And so, that's always something that you can offer. And it's a way for families to just support their child's development with easy things that they can do at home. Does not require families to purchase anything or take their child someplace special. Okay, so the front page is really helpful. They've actually made a lot of adaptations to this based on feedback. So you will see that right at the top, it gives you the administration window, which is really nice. So you can decide which tool you're going to use based on how old the child is. There is an ASQ age calculator that Zulema will talk about in a minute, which will help you if you're math is not your thing. You can just put in the kid's birth date and it will spit out, here's the questionnaire that you should use. So that's really nice too. There was a question about prematurity in the chat earlier. And so I want to point that out. You will see on this cover page, if a child was born 3 or more weeks premature, then put the number of weeks they were premature here. So we do adjust for prematurity up until 24 months of age. The reason for that is because, the thinking is that by about 24 months of age, hopefully, children have more or less, caught up, especially, we know now that when a child is born premature, we do pay a little bit more extra attention, and hopefully they are getting some supports. But in those early few months, we will adjust for that, and we will go through how that is done manually, as well as there is, of course, an online tool that allows you to adjust for prematurity, so you don't have to deal with any math if you don't want to. Okay, so then you get into the actual tool, and all of them are designed the same way. So like I said, we have 21 or 22 intervals. They all cover 5 developmental areas, and there are 6 questions per developmental area. The questions go in hierarchical order from tasks that are considered, a bit more attainable to tasks that are considered a little bit more difficult. And they're all scored the same way, with either a yes, a sometimes, or a not yet response. And then you put the numerical score in the little line that you see, and we will get into the details of scoring in a minute. And as mentioned earlier, it is written at a 4th to 6th grade reading level. I did see in the chat a couple of people talking about concerns about reading level and literacy. Absolutely a valid concern. If you feel like that is an issue, it's perfectly fine to just, and the family can't do it on their own. That's when it's really important that you're there with them and you can read out the questions for them. Okay, and so what are those 5 domains? You'll see them pop up here. So they're communication, gross motor, fine motor, problem solving, and personal social. So each of the tools has all 5 of these domains. The personal social is not so much, like social. It's not really like how they're doing emotionally and with their social skills. It's more kind of adaptive and self-help types of skills. And so that is why there is a companion tool called the ASQ-SE, which we will be offering a training for that in a couple of weeks. And that one really does cover like how a child is doing with their emotional regulation, their social skills, all of that. So I really like to use both tools together, especially if I'm do have concerns about social emotional. I will always do an ASQ as well as the SE. So my recommendation is you don't get enough information if you just do the SE as a standalone. Okay, and then so the actual questions on the tools, you'll see I talked about some of this. They go in hierarchical order. And then the questions that are 5 and 6 on each of the domains, those are the questions that are actually exactly at age level for whichever interval you chose. So this one is, for example, at the 16-month, questions 5 and 6, if a child is able to do those, they are performing perfectly at age level. So it does not look for any advanced skills. It will just look for, are they at around age level, or a little bit below. So the way that they do this, and, I'll just briefly mention this, but not anything that you guys need to like get stuck on. And they use something called a developmental quotient, which looks at, developmentally, where is this child? So if a child is able to do 5 and 6, they are developmentally at 100% of their DQ. They're at in this example, the 16-month. If they're able to do questions 1 and 2 are at about 75% of the DQ. So on a 16-month questionnaire, questions 1 and 2 are something that you would expect of, about a 12-month-old child. Questions 3 and 4 are at, I think it's 88% of the DQ. So that's something you would expect out of a 14-month-old child. And then questions 5 and 6 are at 100% of the DQ. So in this example of a 16-month questionnaire, those would be the ones that are at 16 months. So sometimes people say, oh, if say yes, yes, yes to everything, does that mean this child is advanced? And no, it doesn't. It just means that they are performing at age level. Okay, so then the last part of the ASQ is the overall section. And this is an unscored section. It's more open-ended. It's an opportunity to have more conversation with the family about something that maybe is still a concern that didn't come up as you were using the tool. It's also an opportunity to look more at the quality of the skills. So I remember once I was out doing a home visit with the family, and it was looking at I was at the fine motor section and asking if the child can stack, I think it was like 4 blocks or 5 blocks. The child was able to stack them, but was their hand was shaking as they were doing this. It was definitely not something they were able to do smoothly. So the ASQ wasn't really picking that up. So this is a place where you can note something like that, that the quality of skill, the smoothness, the ease with which they did it, that there was some, concern maybe around that. This is also a place to look at the family and medical history, as we already talked about. That can have a big impact on a child's development. So you want to make sure that you capture some history around that. It can also be a place to capture, as I said before, a parental concern that maybe wasn't brought up as you were doing the tool. And as Zulema explained, those are very predictive and should be taken seriously. And then anything that, you notice, they notice, anything that you feel, this should really be followed up on. So it's kind of a place to get anything that might have been missing or was a gap when you were doing the tool. So it's nice that they did actually make several changes to this and adaptations based on feedback they were getting about things that folks who were using the tool felt were missing. Okay, and then we have this next section. So here's where you take all of that information. So from your cover sheet, from your actual questionnaires and your overall section, and you can put it all into one summary sheet. So each summary sheet is specific to each interval. So, you'll see at the top is your kind of your demographic information. You want to always note the child's date of birth and the date that the tool was completed and any prematurity. This next section are the scores. And you will see that there's different shades, the bar graph. So where you see the darker shade, if a child scores in that area, that is considered of concern. If they score in the lighter gray area, that is considered we should be monitoring here. And if they score in the area that is not grayed at all, that's considered they're mostly on track. You will see in the left-hand column the cutoff scores. And so the cutoff score is where, it differentiates between of concern and monitoring. And those are going to be different for each interval. So you have to make sure you use the correct summary sheet per interval. And then there's transferring your overall responses. So you can, put any of that information there as well as any comments. Then you see that there's how you interpret the scores, which I just talked about with the different shaded areas on the bar graph. And then a nice section where you can it's a checkbox of what follow-up you and the family have decided on together makes the most sense for them. Are you going to monitor? Are you going to rescreen? Are you going to make a referral? Do you think this child needs an assessment or no further action? Any of that. And then finally, the last section, it says optional. And so this is where if you want to actually transfer the individual score of each question into one place, you can. And this is helpful if, for example, you're working in an agency and you're sharing ASQ information with lots of other professionals and you're needing to, I don't know, people still fax stuff, but if you need to fax it over and you don't want to fax over the entire tool, if you have all the information right here, you can just fax over this one sheet. And it's kind of a nice, quick, when I was supervising folks, I would often just, let me look, because I was reviewing so many ASQs, I would be like, let me just look at the summary sheet. And that would give me a nice picture of what was going on. So it's a great way to kind of have all the information in just one place. So I like that. So that's what the tool looks like. They're all set up the exact same way with that cover sheet, the questions, the 5 domains, the overall section, and a summary sheet.
Can I just jump in, Sujata?
Yeah, please.
So my recommendation usually is if you're doing a send home method, so if you're sending this paper home to families, to leave this sheet off. There was a question around, where do professionals sort of come in? And so everything that Sujata talked about before, the cover sheet, all the questions, the overall, that's really all for families to fill out. When it comes to this summary sheet, this is where we jump in as providers, as professionals. So we are the ones who fill out this information summary. We're the ones who are going to score it. We're not really asking families to fill this piece out. This one is for us on our end, so that we can start to get a sort of a first glance at the results and see where that questionnaire is leading us in terms of where this child is developmentally, their strengths, and any areas that might require a little more follow-up or support.
Zulema, there's also a question in the chat about how do we get the tools in other languages outside of English and Spanish? I don't know if First 5 has tried to do that in the past. When I was there, we did only get it in English and Spanish. Do you have any information on that?
I don't know. I know that ASQ Online has primarily been English and Spanish. You can, on their website, on Brooks Publishing website, you can order them in different languages. For the most part, the different languages mostly just come with a CD-ROM, which is a little bit challenging if your computer doesn't have one of those DVD drives. But I think that I think they're looking at it. But that's a really good question, and I don't know that I have a full answer to it. But maybe if you, I was going to say, maybe if we do a little bit of research and you come to some of our other learning opportunities that we're going to be talking about later, our learning lab or our ASQSE, maybe we can have that answer to that question.
Yeah, I think, because I do think you can get it. Well, I know that they have translated into French, Vietnamese, and a couple other languages, but I know that they haven't gone through the full validity reliability process for those. But yeah, when I was with First 5, I know if we needed it in another language, we would just have, like, I used to use the tool in Hindi, and I would just translate it out of my head. So, I think people have done that as well. Yeah.
And again, because it hasn't gone through that whole research and validation, just be a little more cautious. Right? Cautious with interpretation. Okay. Oh, we're here already.
Yeah.
Yay. Okay, so we're going to take a little bit of time and put you in breakout rooms. So remember, at the beginning, we said we would be doing breakout rooms. So this is where your camera comes on and your microphone, you unmute yourself because you're going to be talking to each other. So we're going to give you maybe about 10 minutes. And now that you have a little bit more information, there's also some resources in that link that you have for your where is it? Here it is. Okay.
Catherine put it in the chat.
Oh, okay. Yeah. So there's this one. So one of you is we're going to do a little role play. So one of you is going to be role playing as a family member, and another one is going to be that provider, that professional. And so you can use this as a way to help guide that conversation. But really, if you're the professional, you're going to introduce this ASQ to your family member, talk about as much of the detail as you want. And then if you're a family member, really think about what questions you might have if somebody was giving this to you. Push back a little bit, ask some of those questions. On the other side or on the second page, there are some frequently asked questions that you might want to throw to your provider and see if they can answer it. Okay.
Yeah, and we'll give you about 10 minutes, Zulema. We're just a tiny bit behind, so we might shorten it to like 8 minutes.
Okay. Okay, welcome back, everyone. I hope that was helpful. If someone wants to, either in the chat or out loud, share some of the highlights that that you heard in your room, if you want to talk about if that was easy, something that you heard that you thought was really an introduction that was really nice that you might take with you.
Hi, my name is Stacy. I'm with the Family Resource Navigators, and I got to speak with Jenny, and she is in the primary school setting. And it was really nice because where I come from, I'm a family professional, but we would do a lot of walking with the parents and supporting the parents. And she brought something to my attention that I remember was very helpful, especially with families who have English isn't their first language, is their agency doesn't send the questionnaire home with the parents. They actually do it there. And I like that approach when parents don't feel very confident or have those immediate questions that they may not remember when they're filling out the questionnaire. So it's really good to have that support there when the parent and the provider is helping assist the parents or caregivers to fill out the questionnaire. It just is, they found it more helpful and strengthening for the parents to be able to answer those immediate questions, whether it is, it's not that your child aren't meeting these domains, but what are we going to do to help them get there? Like they can, things are possible, and what can we do to get there? Reassuring them, because sometimes families and parents reassure the families that they're not the responsible, it's not because of something you didn't do that we're having this questionnaire. You know what I'm saying? So that was really good to just have that.
Thank you. Thank you for sharing.
I would just maybe echo definitely what Stacy says, especially with tools like this, if maybe the parent takes it home, maybe going back over it with them, just like when you meet with them, I guess for further, because there's always like additional questions I feel like they have answered or to reassure. So definitely agree. Thank you. Yes.
Yeah. Thank you. Carol, I think I see your hand up.
Yes, I would like to share too. I was in the room with Sumira, and she works in the United United. Let me check. What is that?
Unity Council.
Unity Council. Thank you. She speak out. Oh, there was a lot of great information because I'm working for 4C Alameda County, and I'm also inclusion navigator. So I face to the family and the family child care a lot, and we also had some topic going on. Workshop talk about communicating with a family when concerns arise. So for a lot of family child care, they don't put that the ASQ, the questionnaire in their enroll standards. So for that center or that hand start, they're doing that all in their first when the kids come into a school first 45 days. So those is a huge difference. So for our family child care provider, I used to be a family child care provider too. So I can feel that they don't have enough tool to screening or to understanding their kids. So that's why they face a lot of denial when they talk to their parents. If they feel like the kids need to the early intervention, but the parents don't have a tool, so they don't understand how they can, how they can manage it and how they can help each other. So those is a really great information I get from her, from her school side, and they even has their mental health division consultants in their school sites to directly help the children if they are monitor, they have any concerns. So those is a really great information to me when I sharing tonight. I have a workshop tonight. That will be really valuable for my, for my sharing. Thank you.
Thank you. Yeah. Lori, I see your hand up, but I think just for, we still have a lot of information. So I think we're going to move
No
on.
problem.
If you could put it in the chat, that would be great.
Okay.
Yeah, thank you. So like you all mentioned, this is a really great exercise because one of the things that we always talk about is if we are involving families, we really want to be as transparent as possible. And so that initial introduction is really going to set the tone for those conversations that come up, right? And so especially if there are concerns. And so the way that I usually approach this introduction is to really think about what questions a family might have and then gear that towards my introduction so that I'm laying out everything that a family might be asking themselves as if I'm handing this to them. And I preempt that with the answers already so that I really am thinking about all of the questions that might come up. And then in that initial introduction, I'm answering them all and just being really transparent. So in that handout, hopefully that you got to use, you did see a, you did see some of these frequently asked questions, right? And this is something that in your introduction, you might want to say, right? A family is going to maybe push back and say, I don't really have time to do this. We know that families, a lot of our families, especially if they're, sort of lower resourced, might be working multiple jobs, have multiple children, multiple responsibilities. And so they might push back a little and say, you're the teacher, you're the professional, you're the provider. Why can't you do it, right? And so we really do want to preempt that question and say, this is a family completed questionnaire. You know your child best, right? I might have some ideas, but it's really important to get your expertise on your child. It's really going to help me do a better job supporting your child's development. What can I do to support you in order to fill this out, right? Like thinking about how to preempt that conversation and really offering some suggestions around how we can do it together, because we can't really do it without them, right? There are some questions, especially on that overall section, that we might not have the answer to. And so we really want to make sure that we're letting families know that their experience, their expertise is really necessary for us to really do the best job that we can do. We also want to think about families who might have a little anxiety around this, right? Why are you asking me these questions? Is something wrong? Are you worried? Should I be concerned? And we know that if we use the tool the way that it is functioned for all families, we won't get this question, right? So this question usually comes up when we're self-selecting children that we're already concerned about. But we really want to make sure that we're using this tool as a screening tool, right? For all children. It's good for all families to know more about their child's development, whether or not there are concerns. And so the way that we can answer this question in that introduction is say, this is something that we do with all of our families. We offer this to all of our families. We know, the science behind, like Sujata mentioned, the brain science, those first 5 years are so important in terms of really looking at a child's development. So much is happening. This is where the most rapid growth is happening. And so we're just asking these questions because we know that development builds on itself. And so we want to just every once in a while routinely check in and see how they're developing, where their skills are, where their strengths are, and if there's any areas that might need some extra support or practice. This is also a really important question to answer, I think, ahead of time. And it also really helps set that tone, right? Who's going to see this? Especially there was that question around, systems that have caused harm, right? And knowing that families might be worried about being connected to that system or or having that system look at what's going on, right? So really thinking about that transparency at the beginning can go a long way to having families sort of be able to trust that this is not going to be something that is used against them, that this is really a benefit that we have, that we're offering, because we care about where their child's development is, and so that we can support it, right? So really being transparent from the get-go sets that tone. And you can also start setting that tone for follow-up and next steps, right? So this is really something that varies from system to system, right? So think about where your agency is in terms of who has access to these, and really answer the question. For the most part, you know, there's not going to be a lot of you know, other people looking at this, right? So you can be transparent and say, you know, this is up to you. We can keep a questionnaire here in the child's folder or in their record. You can choose to share it with your pediatrician or with other providers who work with you. You know, if you don't, we recommend that you do share it with other people so that they are also on board. But let them know that that we're never going to share that information unless we have their permission first, right? So that's really a key part of this, is that, you know, there might be some outside agencies that we think might be helpful for you and your family and for you and your kiddo, that I might recommend to you, but I'm never going to do that without letting you know first and without getting your permission. So we really want to make sure that as much as possible, we're being transparent with families to build that trust, to build that collaborative relationship, right? We want to make sure that we are always keeping that family informed with what we're doing and how we're doing it. And that's really going to go a long way to build that trust, so that families feel comfortable answering these questions, feel comfortable that the answers that they give us are really going to benefit them and benefit their child's development. So thinking about that piece, right? So there is a lot of pre-work that you can do to start that process. Obtaining consent is always the first part, like we mentioned, right? Being really transparent and saying, this is what we're doing, this is why we're doing it. And one of the reasons why we do that exercise of introducing is because you might have families come up to you with a question. And so practicing that introduction, practicing, you know, learning more about your own reasons for using this questionnaire is going to help you explain it and explain the process better to families. So really, we want to make sure that we are doing that from the get-go, right? This is something that we do even before we hand out that questionnaire, because it's really going to make that process smoother, avoid barriers, avoid questions, is really thinking about that explanation, thinking about that introduction, and giving families that information that they are going to need in order to fill it out, right? So we're going to determine which questionnaire based on that child's age. If we're going to offer this or send it home, we're going to let them know, hey, this is coming in the next couple of days. Look out for it in, you know, your kiddo's handbag or folder, or we're going to schedule a time to sit down and talk through it together. And if you need some materials, you know, there are certain questions that ask about, like Sujata mentioned, blocks or Cheerios or other types of materials. You might want to check in with the family and say, hey, here's some things that you might need in order to fill these questionnaires out. Can I help with that? You know, we have a playroom here where we have access to those toys or materials. In the handout, there is a list that has all of the materials in each of the questionnaires. So if you know you're going to do, let's say, a 24-month questionnaire with a family, you can look at the 24-month and see if there's any materials that you might need to pre-assemble if they're coming in and you're going to sit with the family to work on this questionnaire together. So when we're talking about choosing the most appropriate interval or questionnaire, right, we want to make sure that we're giving the right questionnaire for the age and stage of development of that child, right? ASQ, ages and stages. There's a couple of different ways for us to do this. You can do it by hand. Some people really like to put pen to paper and do that math. Math is not one of my strong suits, so I tend to avoid it as much as possible. And I like to use technology that was created for me to make it easier for me to do this. So there are a couple of ways to do it online. You can download the ASQ app. It is available wherever you download your apps. So you can have it right on your phone or your tablet or your smartphone. And it has the same calculator that you can find online. A lot of people don't like to have extraneous apps on their phone. So if you don't want to download it, but you still want access to that calculator, you can go on their website, agesandstages.com, and look under the free resources. There is this age calculator. It's really nice. It does all the work for you. You put in the date that you're either handing out or completing the questionnaire, the child's date of birth, how many, if any, weeks they were born premature. You hit calculate, and it gives all that information to you. It gives the child's age at administration, their adjusted age, and it even tells you specifically which questionnaire, ASQ and ASQ-SE, to hand the family that day. If you are somebody who likes to do it by hand, there's also this administration chart that you can also find at agesandstages.com. They have a bunch of resources specific to the ASQ and the ASQ-SE. So if you, and also in the handout that, in the link for the handouts, we're giving you the quick start guide. This is going to, if there's any resources you leave with today, please download that one. The quick start guide is everything that we're talking about condensed into 4 or 5 pages, including the formula for how to find a child's age at administration. There's 2 different ways to do it. There's the adjusted age and then the corrected date of birth. Both of those formulas are found in that user's guide. But if you use one of those formulas, you can use this administration chart to then say, okay, well, I know what their age is in terms of months and dates. And then you can just use this chart to find which questionnaire for the ASQ and the ASQ-SE. So once we get here, right, so all up until now has been sort of the pre-work. We hand that questionnaire to the family, it goes home, or we sit with the family, they fill it out, and now it comes back to us. And this is really where we use that information sheet to do the process that our role requires as the administrators or as the providers. So the first thing that we are going to do is we're going to review all of the responses, right? Go over each of those 5 areas of the questionnaire and see if there are any questions that are missing. For the most part, if we've done a really good job of explaining the content and the purpose, families are going to feel confident and feel like they can rely on giving us those answers. We won't see a lot of missing questions because, again, these are questions that they'll be able to see. If there are any missing questions, the first thing I want to do is find out why, right? So maybe go back to the family and see, did they have a question about that? Did they just, forget about it? Or if it is an item that is inappropriate due to their family's values or cultures, then we would just leave it blank, and we have a different way of scoring it when there are missing questions. But then we're going to go through all of the 6 questions in communication and look at the answers that the family gave us, right? So if a family answered yes to any question, we assign it 10 points. If a family answers sometimes to questions, we give it 5 points. And if they say not yet, we give that any answer a score of 0. And then we go through and we add them up by domain. So we're going to come up with a communication total. So all 6 questions in communication to get a communication total, all 6 questions in fine motor total, etc. Even though we don't score the overall section, we're going to look at all these answers because they're going to give us more information that's going to help us interpret the results. It's also going to highlight if there are any parent concerns that we're seeing, or if there's anything that we need to follow up with or get more clarification. And then once we have all of that, we're going to transfer all of that information onto our information summary sheet. Okay, so one of the things about virtual trainings like this is that we don't get that hands-on practice, and especially with scoring, it is really good to sometimes just sit down and look at it and see if we get the hang of scoring it, especially if you haven't scored an ASQ before. But we're going to try something here where I'm giving you this this scoring practice. And then we're going to talk a little bit more about it together, because if you see, there is a question missing. But if you just take 2 minutes and practice scoring just this section of the personal section, and we're going to do something called a waterfall, where you put in your answer into your chat, but you don't hit enter until I say go. And then all at once, everybody's answers are going to come up at the same time. Okay, so if you just take 1 minute, 2 minutes, and practice scoring this section based on the answers that you see the family has given us, and then put that answer in the chat, but don't hit enter yet. It's okay if you did it by accident. I know it's sort of a habit. All right, I think everybody should have their score, and go, hit enter now. Okay, so we see a lot of 45s, 52.5, 45, 45, 45, 45s. Yeah, great. Okay, let's talk a little bit about this specific section. Okay, so if we were just to go on and do it that way, we would see, yes, so a yes is 10, 10, 10. This one's blank, so we leave it blank, 10, 5. We would get 45. But let's talk a little bit about that question number 4. While looking at himself in the mirror, does your child offer a toy to his own image? So this question can be due to a family's values. You know, some indigenous, some families who come from an indigenous culture, mirror play is not encouraged or allowed. And so asking a family of that background and that culture this question is inappropriate of us, right? But if we just left it blank, it would be as if we were assigning it 0 points, right? And 0 points has a very specific definition. 0 points is a not yet. And this question is not a not yet. It's an I don't know. I don't know, and it's inappropriate for me to ask. And so what we want to do is we want to give that family sort of the benefit of the doubt, an average of the scores based on how the child answered some of the other questions, right? So we would do an adjusted score, so that we give that child sort of the benefit of the doubt based on how he answered he or she answered all the other questions. So how you do that is you add it up like we just did, we get 45, and then we divide that by the number of questions that they answered. That would give us an average number of points per question, right? So if we divide 45 by 5, because that's how many questions that they answered, we would get 9, right? So based on how they answered all of the other questions, we could assume safely that had they answered this question, had this question not been inappropriate for us to ask, they probably would have gotten 9 points. So we would assign that that average number of points to that unanswered question, and then we would add it all up again. So now instead of being 45, this total score adjusted for that that missing question would now be 54 points. I know I went through that really quickly. Again, please make sure to download that quick start guide that we have in your link. It talks through this process a little bit more. Also know that on the app and also on the the ASQ calculator online, there is an adjusted score calculator as well. So you don't have to do it by hand all the time. You can go to that calculator and do the same thing that we just did right now. But I just wanted sort of to explain the process and the reason behind why we adjust the score. So once we do that, we transfer everything over and we start to see the beginnings of where this child is falling, right? So here is an example of a completed information summary sheet. We're going to use this kiddo Andrew as an example for a lot of the things that we're going to be doing. So this is Andrew's completed questionnaire, 16-month questionnaire. So you can start to see there's a couple of the scores that are falling in that monitoring zone that Sujata talked about, right? So already there's some things that we might want to check in with the family about. We have their overall responses. One of the things that we also like about this questionnaire is that it's very visual in terms of, as providers, how we can interpret. So visually, I already can see, right, those areas that I want to maybe follow up on, ask some more questions on. And in the overall section, you can see some of the answers that they circled are in capital letters and bolded. That is a visual cue that is something that I want to, again, follow up on. This is a parent concern, and that's going to help us maybe evaluate a little bit more or interpret what's happening here based on their answers here. And then you can sort of see again that optional box, how we might use it in terms of giving us more ideas of all of the the way that they answered every single question in all of the domains.
Okay, thanks, Zulema. I think I'm actually gonna, I think you kind of covered interpretation, follow-up. We've talked about this. So I think just in the interest of time, we can go ahead and move to the next slide. Okay, so going back to scoring, just so folks have an idea, have some context for what the scoring means. Remember I talked about how if a child is, yes, yes, yes on everything, it doesn't mean that they're advanced. It means that they are, performing right where we would want to see them. So what this bell curve shows you, I'm sure many of you have seen a bell curve before and you're familiar with what it represents. So, most of the population kind of falls in that non-colored area, in that white zone, right? That's where 68% of the population falls. For our purposes, we're going to ignore the right side of this bell curve because this tool doesn't look at, are you performing better than the average population? So if a child's, doing great and they're sort of like in that typical zone, they're in that spot where you see the little red dot moving up and down. If they're in the monitoring zone for any of those domain areas, they're in this kind of blue, dark blue area. And it means that they're one standard deviation below the mean. And the reason that that's important is because it's statistically significant. So, and that's what's really of interest to us. There's going to be variation, we're people, right? So we develop in different rates and different ways based on exposure and environment, all of that. Some variation is completely expected. But when you get concerned is because, you're saying, what, this is more than what we would just expect from any of these other factors. So we want to pay some attention to that. So if they're in that monitoring zone, that means they're in an area where a lot of the kids are scoring above them. Now, if they're in that cutoff zone where we're saying that there's a concern, that's 2 standard deviations below the mean. So that means it's really something that's significant that probably isn't being explained by some of these other factors that can impact scores. And that means that actually they're in a non-strengths-based way to think about that is they're in the bottom 2.5 percentile. And so when a child does score of concern, you know, it is really telling us something. It is really saying, you know what, we need to take a further look at this, explore it, do some follow-up. Now, I did see questions in the chat around, you know, what if the parent's in denial? What if the parent, you know, doesn't believe it? Even you've gone through this, you've shown them the scores, and that will happen. And, you know, because as we've both been talking about, this is really about building that relationship with the family, gaining trust, providing support. It is up to them whether they want to take a next step or not. And if they have decided, no, that's not what I want or need right now, you know, we just go into the position of, okay, you know, I'm here to support. What can we do? Can I leave you with some ideas for some activities that are just good for children's development in general? Is it okay with you if we monitor this and, you know, I come back in 2 months? And hopefully over time, you know, there's more trust and more safety, or, you know, we don't know what the reasons are for the parents' hesitation. It might be that, you know, once the child's a little older and someone else mentions it, then they're ready. So, you know, we just kind of have to be patient with that. But it's good for us to know if that child is scoring, you know, in that of concern range, it is of concern. Excuse me. Okay, so what can we do? What are some follow-up recommendations we have? So first, if the child is in that, you know, they're above the monitoring zone, they're doing, you know, they're functioning typically for their age. Great, we can provide some follow-up activities. We can offer to rescreen if, you know, everybody's program is different. So some folks have long-term connections with the families, some don't. But, you know, if it's above the monitoring zone, you can assume that things are more or less on track unless the parent brings up a concern. If it's in that monitoring zone section, then that's where you really want to monitor. So, you know, leaving them with some activities that they can be working on with their child, suggesting rescreening, depending on the age of the child, you know, and what your concerns are with the parents. 2 months is generally considered, you know, that's a good time, a lapse of time. Of course, the younger they are, the more often you'll want to rescreen. And if the family is open to it and you think it's appropriate as well, there's nothing stopping you from making a referral, even if they're only in the monitoring zone. If you think that's warranted and the family is open to it, certainly, you know, you could go through that process. Of course, you know, if a referral is made and that leads to an assessment, that is a much more intensive, timely task. So family needs to be kind of ready and open to that. But yeah, there's nothing kind of stopping you from doing that. Okay, next slide. And then if they are below the cutoff in one or more areas, that's really when we would say, you know, let's do some further investigation. So this was just a screener. You know, it told us like, hey, we should look further. There is some, you know, at least one domain that's below the cutoff, and we would really want to then recommend that some further assessment is done to see if there's really is something going on or not. And if they go through that process, determine they're not eligible for entitlement services, because those cutoffs tend to be, you have to be, you know, their scoring is not very generous in terms of what qualifies you for services. Then we would, you know, still say definitely try and stay involved with the family, continue to monitor, continue to offer activities. And, you know, you can also make repeated requests for assessments as the child grows as well. And then finally, just, I think we've belabored at this point already, but, you know, take parent concerns seriously. So regardless of what this tool is telling us, the parent has a concern, we want to follow up with that and leave them with something, you know, that they feel like they can do to support their child's development. Okay, so we're going to actually, I think I'll walk through this real quick, and then we're going to give you a chance to talk about Andrew. And there's some documents in the handouts folder that we'll be referring you to. So you kind of got a little bit, you saw Andrew's overall summary page. And here are the follow-up actions that this provider is recommending. So they're recommending that there's a rescreen in 2 months. Remember, Andrew completed the 16-month questionnaire, so he's on the younger side. Recommendation to share these results with the primary care provider, and then referral for hearing screening. So if you remember when you were looking at the overall section, there were some notes around, he seems to ignore me, grandma wears a hearing aid, talking, the expressive speech, parents had some concerns around that. So this is what was recommended. And now I think your task, let's see. Oh, okay. Let me just talk about this real quick too. Okay, so we talked about how pediatric offices, many of them are now using the ASQ tools, and it's really nice to have that common language between people like yourselves who are maybe not working in pediatric clinics, families, and then those in the pediatric office. So it's a great way to share information with them. And one of the reasons that you might want it is especially if there's possibly a medical issue going on. So again, with Andrew, there's some concern around his hearing. And pediatricians can also help with making referrals through other systems as well. Certainly doesn't hurt if more than one person is advocating for the child and asking for a referral or assessment. And, pediatricians often carry a lot, their words can carry a lot of weight. So there's lots of good reasons to really partner with pediatric providers and healthcare providers around this work. All right, so what we're going to do next is give you all a chance to go back to your breakout groups with your partner, and you're going to actually talk about how you would share these results with Andrew and your recommendations with Andrew's family.
Can I jump in really quick?
Yeah, please.
Also, if you are somebody who's coming from the healthcare system, a healthcare setting, inversely to this one, we also recommend that you ask families to share if they have a preschool teacher or an early childhood education setting. And this way, again, we're providing that connection between all of these different systems that a family that has eyes on this family and this kiddo. So if you're doing a screening in a healthcare setting and there are some concerns, maybe recommend that the family share this with their teacher, can help that teacher provide some of that extra support in that area of concern as well. So back and forth, if you're somebody who's not from a healthcare setting, recommend to families that they share with the healthcare setting. If you are somebody who's in a healthcare setting, recommend that they share with an early childhood education setting.
Thanks. Okay, so there's a couple of handouts. Zulema, do you want to share the page with the handouts so folks know which ones they should be looking at?
There we go. Okay.
All right, great. So in your handouts, you have, the summary sheet, which kind of has all of the information. And then you also will have, I think it's number 5 we want to click on. Okay, so this kind of walks you through the activity. So you're going to review the results. There's a little bit of background information here, which you take a minute to read that. And then tells you about, he was born premature and some family history. And then you're going to partner with somebody, and one of you is going to be sharing the screening results. And there's a handout here that gives you some helpful tips. And the other person will be in the role of Andrew's family. And you're receiving this information, asking questions, whatever it is that you feel like you need to do. And we just want you to have that experience of being able to share results and see what that's like. And we will take about 8 or so minutes again.
Okay, welcome back, everyone. So we're nearing the end of our time together, but we do have time for maybe one or two people, one or two of you to share out maybe something that you heard or something that was highlighted for you, maybe a moment that made you think, oh, that's a really good way of doing it, or I have to think about this method. So if you want to, just one or two of you jump in. Or you can also put it in the chat.
Zulema, this is Martha, and I was in the room with Peggy, and she brought up something very important. I work within the health system, so it's really easy if there's a concern. Usually the referrals are made by the developmental specialist that has done an assessment, and so if I call over to audiology, they know that the referral is made and it's coming from a developmental specialist. But if you're not working within the hospital system or within a clinic, sometimes the parents, when they go to the pediatrician, they'll say, oh, I don't know, my social worker or my home visitor told me that my son needs an audiology exam, but they can't quite explain why. And so, that was a really good point, that they're at a loss for words or why they need this audiology referral.
Yeah, that's a really good point. And that's something that takes practice, right? Or even just knowing what resources you're connecting families to. So really thinking about when you're sharing those results and when you're making those recommendations, how do we phrase it in a way that families understand why we're making those recommendations and where we're referring to? Good point. One more person?
I can go.
Yeah.
So I work at primary school and we actually have a process. So since the parents already have a concern, it's automatically a children's circle where we meet up with the parents again and we talk about each question. We go through all the results and each question and why they got that answer. And we talk about if it's still true this day, and we'll also address the concerns. We also are in partnership with Kaiser. So we would send the results to Kaiser and let them know that the parent has a concern. And we would check in, we would encourage parents to connect with their child's pediatrician to let them know about the hearing concerns, because sometimes parents don't feel like it's necessary, but it does come, that concern does arise during the ASQ. So we let them know to please contact their pediatrician. We also follow up to ensure that they have, to make sure, the child is able to get those hearing tests if that is something that is needed. So yeah.
Great, thank you. That seems like there's a lot of support around that family and around those concerns, which is always really great to hear, especially because when we're using these questionnaires, we want to sort of think about that whole process, not just for the families, but also for you as providers who are administering this questionnaire. Do you have the support that you need in order to do all of the things that this questionnaire might be asking of you, right? Do you have the capacity to make those referrals? And if not, do you know if there's anyone who can support you in that as a provider, or really what your process is, what your flow is in terms of providing these questionnaires? One of the tricky things is that they look so easy because they are developed that way. They're made for families to fill out. So on the front end, it looks like it should be really easy, but there's a lot of work that goes on behind the scenes in order to really think about the process of supporting and promoting child development, everything that goes along with it, including having difficult conversations, including connecting to supports. And so we're really thinking about that on our end for you as trainers. How do we provide you with the information that you need in order to start handing and using these questionnaires in your system, whatever system that might look like. Okay, so now let's talk a little bit about having those conversations, right? So we want to make sure that anytime we complete a questionnaire or an ASQ with a family, that we're thinking about sharing those results, regardless of concern, right? All discussing the results with all of our families. And a lot of these are things that you already do, so I'm not going to go too in depth on it because I'm sure all of you are already doing all of these things, right? So making sure that we're planning for language issues, right? We might be administering, but the person who has the best connection is to the family is somebody who speaks their language. And so maybe we pull them in for this piece, right? So they have that relationship, they have that language, then they can be part of this process. Always want to make sure that whenever we're sharing results, that we do it in a way that honors that family's privacy, and so that we are doing it in a way that ensures confidentiality. We're not having conversations in open rooms where people can walk in. Sometimes even if the kiddo is there, we might want to think about having other places where that child might be for a little moment while we have these conversations. If we're doing it virtually, right, making sure that the family understands that we're going to be talking about some stuff, and to prepare for that, maybe have a space where they can go where nobody else is around, where they can really attend fully to the conversation. Always want to start with celebrating that child, right? Knowing that this is a kiddo with lots of strengths, even if there are a lot of concerns, there's always something to celebrate. Always a lot of that we can talk about how much we enjoy working with this kiddo. We always want to go over, again, review why we're doing these questionnaires, why we're asking these questions, what's the benefit for them as families and for us as providers. When we're talking specifically about the questionnaire, always start with the strengths, right? I don't know about you, but if somebody starts telling me all the things they're worried about and then goes on to tell me the strengths, I'm not going to really be able to pay attention to the strengths. I'm going to be so focused on the concerns that that's all I'm going to hear. And so we really want to make sure that families are hearing those strengths, because a lot of good is happening, even if there are lots of concerns. We want to make sure that we use terminology that accurately represents what we're doing, right? So this is not a test. Sometimes I don't even say screening for families. I say questionnaire. I don't know if you've heard me sort of say that along the line. I often will say this is a questionnaire that we use to learn more about your child's skills and progress, where they are right now, where their strengths are, and if there's anything or any areas that might benefit from extra support or some more practice, right? So I don't say pass or fail. I don't even use above the cutoff, monitoring zone, below the cutoff, because what does that really mean to families, right? So really thinking about the terminology that we use with families when we're sharing the results specific around the questionnaire. Always, this is a conversation, right? So especially if we're seeing some things that maybe a family might not be as concerned about, right? We might be concerned, but the family might not. They might have other things that they're working on or other things that they're looking at. So really, this is a conversation. Invite that family to share their own observations, their own ideas for what's going on, their own ideas for resources that they might have. Families are a wealth of information if we just give them that space. They might already be connected to services that we might not even know about. They might have a pocket of resources that we've never even heard of, right? And so we really want to make sure that we're inviting them to share that and giving them that space to talk about what they're seeing and what they're concerned about. Now, specifically when there are concerns that we're seeing, especially that the questionnaire is bringing up, we want to make sure that we're having that conversation again in a way that is the most beneficial to families, that are going to really help us move the process forward, right? So we want to think about what it's like to hear some of these concerns. For some families, it might be the first time that they're hearing that something might be going on with their child's development. And that is a really scary thing to hear if you think about it, right? These kiddos are so young, and this family might have, all of these really great expectations. And now to hear that something might get in the way of those expectations and those dreams and hopes can be really challenging. And it could be difficult for us to share that information. So we want to make sure that when we're having those difficult conversations, that we always think about where that family is in the process, right? Really being observant to the cues that they're giving us if we're doing this in person, right? Some families, as soon as you start sharing your concerns, they might look like a big weight has just been taken off their shoulders, right? They have had this sort of fear in their gut for a while, and now you're actually sharing that same fear and that same concern, and they might be like, what do I do? And you're giving them suggestions, and they're taking it all in, right? They're like, yes, I'm ready. What next? Or you start sharing these concerns, and you might see some confusion in their face. You might see them start to pull back, right? They might not be sharing the same concerns, or they might be really confused about why you're saying these concerns. They might need a little more time, right? So we want to make sure that we're looking at that and gauging our own conversation with meeting where the family is in terms of hearing that information, right? We might want to pull back a little bit and not jump straight to a referral to early intervention or early childhood special education, which might be hard for us, right? Because if you've heard Sujata and I talk about early intervention, the earlier the possible, but for some families, they might need some time to process, right? They might need some time to go back and get a second opinion. They might need some time to make their own observations or look at other things that might be happening. So we really want to make sure that we're having these conversations, not just trying to reach one specific point. There are many different doors that we can open for families that will help us get the support that this kiddo needs the most in a timely manner, right? So we want to think about when we're sharing concerns, be really specific about what we're seeing. So we might have to, before we have this conversation, we might have to go back and do our own observations, right? So really being able to see, okay, specifically, what can I share with a family? For example, for some of the younger kids, we might say, at this stage in their fine motor development, we're really looking for pincer grasps, right? We're using these two fingers to pick up objects. When we, give objects to your kiddo, what we're seeing is not so much this, but maybe more scooping to get the items. And so let's think about how we can make their little muscles a little bit stronger so they can start to do that, right? So we really want to be specific about our concerns, specific around what we're seeing, so that they can then say, oh, you know what? You're right. I never noticed other kids are doing other things differently, right? So we really want to make sure that we're sharing things that are easily observed, that they can then say, oh, you might have a point there. Also, we want to make sure that we're having this conversation in a supportive way. We're just giving information to families. What they do with it is up to them, right? This is something that is oftentimes a hard thing to sit with as somebody who is a firm believer in early intervention and early intervention services. We really are just giving information to families and letting them decide what makes sense for them and for their families. It is not our job to convince parents that they need this referral. It is our job to provide options and let them think about what is going to best support their family at this time. Really thinking about what can we do to sort of continue that relationship with the family and not hinder it, right? So really thinking about how we're having these conversations and giving that family the time that they need in order so that we can continue that conversation and not make it so that families don't trust us anymore because we're pushing too hard in one direction and not taking the time to listen to them. Okay. Oh, one of the things here I did want to sort of mention, rescreening is always a good option. So if we have concerns and the family, and we make a recommendation, say for further assessment, either through the regional center or through the school district, and the family says, you know what, I don't want to go that route, we might say, okay, well, here are some activities that you can do at home. Let's come back in 2 months and look at this questionnaire again, right? So rescreening is always a good option, and it gives parents more time to sort of think through what they're seeing and to continue to give them more questions in order to check in on some of those concerns. Great. So in summary, these questionnaires, these tools are very helpful. They can help us bridge that communication with our families. They can help engage our families more in this process with their child's development. They give us an idea of where to connect families to and kiddos with within their community that can help support their child's development. We know that when we're making those considerations about referrals and next steps, we don't just want to use the score. We want to take in a lot of different considerations, our own observations, the family's observations, other things that might be impacting the score or the child's development, because it is a very complicated issue, right? All children, we have these milestones and things that we, expect to see typically at this age, but all children are different and develop on their own time and at their own pace. And so we want to make sure that we're really using all of that information in order to come up with some good recommendations and resources. So thinking about resources, I know there's a lot of questions in the chat about where can we connect families to when there are concerns or resources. And so I want to take a little bit of time and talk about our own program called Help Me Grow in Alameda. So we are an agency for all of the county of Alameda. So all the different cities in Alameda, you can refer families to us. We do have a video. I'm going to come back to it just for the sake of time. If we have time, I'm going to play it. But I do want to get this information, which is really important, about all of the support that Help Me Grow can provide for you and your families. So we do have our phone line. This is the number 1-888-510-1211. You can have families refer themselves. They can call, or you can fill out a referral form. There are child development specialists on the other end who are multilingual. They speak Spanish, Cantonese, Mandarin. If a family needs a different language, there is interpretation services available. And they also can link families to other agencies. They can make other referrals to other agencies, give family more information about specific activities. They can send families specific activities around that area of concern. So I know that in the chat somewhere, they were saying, are there free resources for activities? Yes, call the phone line and they can help that family get those activities to support and promote their child's development. And they can also provide some care coordination around, some of those more complicated cases for families. We also have a developmental screening program, which is a great way to connect families so that they can continue to do that monitoring process, right? So you might only have this family, for a brief moment in time, but you want to make sure that they are continuing to get that opportunity to do screening. Connecting them to the developmental screening program is a great way to continue that surveillance, that monitoring, that re-screening process. So it provides families with the ASQ, either through their email or on paper. They send families activities afterwards. They send, for a family that's registering for the first time, they get a book. And then if they continue to do it for the next 5 years, they will get a little present on their birthday, on their kiddo's birthday, and also can connect them when there are concerns. All of this information you can find on our website, alamedakids.org. So there's information about the phone line. There's information about the developmental screening program. We also have resources. So all of those are resources for families mostly, but we also have resources for you as providers and professionals. We just recently, I think it was either last week or a week ago, we had our first in-person Connection Cafe, and it was all about networking. We had some agencies in the community come and talk about their resources, but we also have specialty topics I think it's every quarter. So it meets quarterly. You're always invited to come and network and learn more about all of the services that we have in Alameda. We also have a listserv that comes out twice a month that has just a wealth of information of other trainings in the community, not just our own, but all of you are also doing some really great trainings. We have a lot of family resource centers who share their calendar. And so you can look to see if there's a topic that a family might benefit from and connect them to that. Also resources, right? So a lot of our families, what we're finding is that there are developmental concerns, but the thing that they're most worried about are basic needs: housing, food insecurity, unemployment. So all of those things you can find on our listserv as well, resources for that, a diaper bank, food banks, etc. And then there's also some support for you around that process of setting up a system of developmental screening, early identification, and connection to supports and services. So we can, as providers, we can do some consultation and support around developing that screening system if this is the first time that you're going to be using these questionnaires, or if you just want to maybe take another look and say, hey, there are some barriers that I'm seeing with my families. How can I, strengthen this or enhance this system to make it run smoother for myself and for my families? And then I just want to share, we talked a little bit about this, but we do have another training. Sujata and I are going to be talking about the companion tool to the ASQ, the ASQ-SE, Ages and Stages Questionnaire, Social Emotional, 2nd edition. That's coming up February 28th. It's a little bit shorter. It's from 10 to 2. And then we also know that training only goes so far. And so we are also coming back in April after you've had some time to think about your process, to think about these questionnaires, practice using them. And then we're going to host a learning lab where you can come and ask us questions, any questions that we didn't answer because of the time. You can come and ask us these questions, specific questions around families or other things that you might have around this system of developmental screening and early identification. That's happening April 24th, also from 10 a.m. to 12. This is my information, my contact information. Please feel free to, I know that we sort of ran through that last part pretty quickly. But if you have a question that can't wait until April, feel free to call me or email me, and I will do my best to answer any question that we couldn't get to today, just for the sake of time. And I want to thank everyone for being here and participating. We appreciate it so much.
Thank you, Zulema, and thank you, Sujata, for an engaging presentation today. We hope to see everyone in our next trainings, and thank you all for joining us today. We do have a link to all the materials, and a training evaluation will be sent to you, so we do appreciate your guys' feedback. Thank you, and have a nice